Hello, everyone. As representatives of ABC Project Management, we are managing the construction of a fast-track COVID hospital for the GTA from conception to finish. We are the key consultants of the project and working under a construction management contract with the Ministry of Health. The site is selected in the central part of the Greater Toronto area, along Highway 400 and a few minutes north of Toronto. The proposal is to replicate the success of the Leishan Hospital in China, which was completed in 10 to 12 days. Hence, the same layout has been proposed to speed up the design process. However, the medical staff residence is not considered in our scope. Through the project charter, we hope to seek a quick approval from the York Region Government and the Ministry of Health. The success of this project depends on spontaneous approvals from the authorities. The key items in the scope are the construction of a 2,300-bed hospital with logistic areas for utilities and waste management. It is proposed to complete construction in under 2 months. The project management plan aims to achieve targets through the building information modeling and product organization modeling that integrates design and construction virtually, reducing the need for on-site requests for information and errors and delays. The requirements will be guided by data collection, and also the requirements of the Leishan Hospital in China have been adapted. 80,000 square meters of construction is proposed in 2 months. These requirements then lead us to the work breakdown structure. The two main tasks of design and construction have been subdivided. Integration is achieved via BIM, that is Building Information Modeling, and POP, that is Product Organization and Process Modeling. BIM modeling is used mostly by designers like architects, structural engineers, and MEP consultants, through which they can design, perform simulations, and extract data. POP modeling involves product, organization, and process. So the BIM model is associated with information related to the product, the organization that's producing the product, and the process that goes in making the product. This enables integration of design and construction. After the work breakdown structure is completed, at the lower levels, the work packages are then assigned to subcontractors, trades, or subconsultants.
The current best practice for this project is the waterfall management approach. This fast-track COVID hospital development, it can relate to the waterfall management approach through the division of project stages, where an example is how we split the project into planning and designing and the construction. So these are two different phases and they're split and they have multiple tasks that need to be done within each. The team's rapid forward progression would mean that we have to build the hospital as soon as possible, so we would need to remain in touch with all the stakeholders and we would need to tell them what we need at hand, and it has to be efficient and direct in manner, and it has to be clear so that they can understand what they have to do. The rigid deadlines would have to be set in our contracts with any people that are constructing or even the employees, the staff, the hospital staff that we need to employ. The direct communication would be between all stakeholders and us, the team members, so that we can stay informed about the construction phases of the hospital. The in-depth track record is basically what we have completed and what stage we're at right now. So kind of like if we're looking at the cost and the budget, we can see how much work activity we have done and how much is left to do, and we can make the required changes by looking at this record.
Now I'm going to talk about the schedule management. Based on research, the Leishan Hospital was built within 1 week in construction. To simulate the similar project and consider the local situation in Ontario, we are planning to finish this project from design to construction in 36 days. Because design layout can refer from the previous hospital example, and there's lots of prefab structure in construction period, so it is reasonable to reduce the project time under 40 days. The project will be split into 3 phases: design, POP modeling, and construction. POP modeling will help to monitor the construction status and give fast feedback for any changes during construction. For this project, we have 4 relations of precedence: finish to start, start to start, finish to finish, and start to finish. For example, architecture drawing must be finished, and then senior architect can review and approve it. BIM modeling can start to create at the same time structure analysis happen. The monitoring of the construction must be finished before project closing. For resource management, because we won't have one BIM design team, the BIM modeling for architectural, structural, and MEP cannot work parallelly. So after leveling, the BIM team can work on each modeling one by one. For resource smoothing, some of the construction team didn't work efficiently before smoothing, and other team just have much more load than them. After smoothing, each construction team has uniformly workload distribution, and we save 9 days for the entire project. For cost management, our budget cost to be set as 40 millions. After calculation, our CPI for 50% completion is 0.52, which is over budget, and the rate is 15.9%. It is because the major cost of this project is from material purchasing, and the cost contributed around the middle of the project. The next step of our project management will focus on how to solve this problem and fix the CPI value.
Thank you, Intel. Now for our stakeholders management, where we decided to organize our 17 stakeholders into the power interest table as seen. We began with healthcare workers at the top left, having low power, high interest. Healthcare workers would be anyone from paramedics to nurses and physicians, working hand in hand as they are the key players trying to get treatment through to as many people as possible. And that takes us to our patients, receiving the treatments in the COVID hospital. Some might see local residents as patients, but in this case, the community would have say in a decision such as hospital location. And that is why we decided to include them in the low power, high interest section. For the design team, we included architects, structural engineers, and the MPE consultants, also in the low power, high interest. Next, the York Region government, which we decided would be placed in the high power, high interest, as the government is responsible for the local resident health and ensuring the project process goes through efficiently. Insurance companies would be in low power, low interest, as their main focus is to have insuring policies that are met from the outside of the project. For low interest, high power, we placed the Medical Advisory Committee, as their suggestions must be taken into account by the project management company during COVID hospital construction process, and this is to ensure the hospital meets the needs when treating those infected. Now for the project's communication management plan, we decided to focus on the groups committed to building or shaping the hospital. Most deliverables would need to be distributed amongst different recipients, such as the start of the project, where we have the project detailed info, and it was distributed to the project management team, the architects, and the civil engineering firm, but was the responsibility of the hospital and the project management. We've also added the hospital management to our recipients for the construction updates, as they're able to help suggest what works best throughout the hospital in the building process and in this deliverable process, where it would take place around 11 a.m. for the previous day work. Since the time would be in stage of the pandemic, we went with remote delivery for most of our delivery methods, like Zoom meetings for the most part. This is to decrease chances of infection spreading and allow for more flexibility in meeting time for the project.
For the fast-track COVID hospital, in the quality management, we would need to look at the needs of the 1 week COVID hospital, where the citizens, which is mostly regional, they will have their needs satisfied through this hospital. The citizens would most likely consider that the hospital will be built within a week, so this is their implied need. They would also want to be tested, treated, and vaccinated for coronavirus, which is another implied need. On the other hand, their stated need would be that they want the hospital to have a reasonable number of staff so that their waiting times are minimal. Another important aspect of the hospital's quality is that the optimal level of quality should be given so that the needs of the customers are met and that the costs and requirements of the hospital are also reasonable while giving the patients the care that they need. One of the policies for the quality of the hospital's health delivery could be created through meeting a safer environment. So, a quality policy idea in this COVID hospital could be having the supplies quantity being always in store in the inventory. So, we would have an excessive amount of the supplies that we have so that we can always make the patients receive their service as soon as possible. And this would meet the need that they had of a lesser wait time. So, this policy could be implemented into the hospital, and there could be a controlling system, monitoring system that could be installed so that the general staff and maintenance workers could meet like a quality officer, and they can give their concerns to him, and he can let the CEO of the hospital know so that these things can be taken care of.
The procurement of various materials, services, trades, and expertise will involve many different types of contracts. However, as this is a short duration project, we will mostly promote the use of fixed price incentive contracts with the intention to reward parties that complete the tasks in time. We have avoided the cost reimbursable contracts to control costs. Instead, requests for quotes and tenders will be utilized for cost control in a competitive environment. We also avoided the time and material contracts as we do not have the resources and prior experience in executing fast-track projects. Performance analytics will be used to monitor progress with respect to the baseline. We will ensure that we close each contract upon work completion.
To conclude, we decided to approach our constraint in time using waterfall management method and POP modeling to have accessibility throughout the project, from monitoring to project status control. With stakeholder management, supporting resources were utilized and organized to allow for a smooth process to be followed, and making sure conflicts were fulfilled to avoid any conflicts. And finally, project success factors that were taken into account as they depend on the resources in the initiation, planning, execution, monitoring, and closing phases. Thank you for your time, and here are the references we've used for this presentation.